All right. Morning, everybody. Thanks for joining us today. I'll go through the agenda real quick, and then I'll go through a couple of slides as well, just to kind of reset the stage since it's been a little while since we last met. So our agenda for today, we'll do our land acknowledgement, and then we'll revisit the purpose, role, and guiding principles from all of the previous work group meetings that we discussed. And then Abby will go and Erica will go through a presentation on the proposal that we are planning to bring to City Council. We have some time for a work group discussion as well as some public comment, and then we'll talk about some next steps as well. So before I get into the land acknowledgement, I just wanted to again reiterate our appreciation and gratitude for your feedback. The first round of meetings were extremely helpful and informative, and we really have taken a lot of time and revisited those discussions and reread our notes and watched meetings to think through all of the feedback and the information that you all gave us that first time. We've also followed along with the conversations that have been happening at the state and really tried to take all of that into consideration. And really our goal, I think we've talked about before, is to balance our goals of protecting public health, safety, and welfare with also just really trying to make this a successful and accessible program in Denver. And so I really wanted to also just thank Abby Soyson for her dedication and hard work and focus. She's become our resident expert and has really been helpful in leading our internal discussions as well as these meetings. And has kept us on track, and she takes lots of questions from us every day and really keeps us going and keeps the conversation pretty focused. And so there's still, I just want to say before we get into the conversation too, I think there's still a lot that we don't know and that we need to learn and figure out. And so we're basing our proposal that you'll hear today on what we know and understand right now. But there's still some details to figure out. And that's what this time today is for, is to continue to hear back from you on this first draft of a proposal or this first draft of a concept. And then we'll go forward with it from there. So with that, we can kind of get started. So I'll read through the land acknowledgement. The Department of Excise and Licenses would like to honor and acknowledge that the land on which we live and work is the traditional territory of the Ute, Cheyenne, and Arapaho peoples, as well as being historically tied to at least 48 contemporary tribal nations. We honor those who have stewarded this land throughout generations and recognize that government, academic, and cultural institutions were built on and continue to enact exclusions and erasures of Indigenous peoples. As individuals and as a department, we are committed to working to dismantling ongoing systems and legacies of oppression and inequity, and we value the historical, current, and future contributions of Indigenous communities in Denver. All right, so just to review the purpose and role of the Natural Medicine Work Group, we assembled this work group and wanted to take the time for you all to provide suggestions and feedback on whether and how the City of Denver should license and regulate natural medicine. As we've talked about before, we did not want this group to re-legislate the state law. We don't have the authority to make any changes to the state law. And so this group is advisory in nature. We are not voting on issues or reaching consensus on recommendations. We are taking your input and feedback to inform those recommendations in the proposal that we will then bring forward. Each member is an equal participant and has equal opportunity to voice opinions and contribute ideas. We'll get through as much of the conversation here today as possible, but there's always opportunity to provide written feedback and other forums as well for providing your opinions and ideas. Like I was saying before, we've considered all the input that we've gathered through this group and from public comments in developing the recommendations that we'll be bringing forward. And any proposal to license or regulate natural medicine businesses in Denver must be approved by the City Council and the mayor. So our guiding principles for today that were the same as the previous meetings that we held. We really value the expertise of our work group members and the unique perspectives of all the work group members here and present and that are participating in the discussion. We really recognize the legitimacy of the interests, concerns, and goals of each other and want to give everybody their opportunity to share those interests and concerns. And along those lines, we want to treat each other and all the meeting attendees with respect, civility, and courtesy. So this is our guiding principle and really expectations for everybody on the work group, for ourselves, and then we'll try to use these in public comment as well. And then just one more revisiting issue. Just wanted to again reiterate where we have local regulatory authority. That's hard to say, regulatory authority, and where we don't. So what we can do is we can enact an ordinances, regulations governing time, place, and manner of the operation of natural medicine licenses. But where we are limited with our authority is that we cannot prohibit the establishment or operation of natural medicine licenses. We can't prohibit the transportation of natural medicine through Denver by licensed persons. And then we cannot adopt ordinances or regulations that are unreasonable or in conflict with state law. So those were some things that we really tried to keep in mind and keep our focus when we were discussing how to locally regulate natural medicine in Denver. So I think that's it for me, and I will pass it back to Abby and we'll jump in.
All right. Hi, everybody. I'm Abby Soyson. I'm a policy analyst with the Department of Excise and Licenses. And I want to go over just kind of filling in the timeline of this year of 2024 and all the work that we've done and that you have all contributed to in developing this policy proposal. So from January through December, all year long, we've been monitoring state rulemaking processes. We've attended stakeholder meetings that the state has held on their proposed rules, both through the Department of Revenue and the Department of Regulatory Agencies. And we've provided comments on the proposed rules and the local impacts that they might have. We've engaged with us at Excise and Licenses have engaged with our partner city agencies to talk about the need for local licenses, the need for local regulations, and what that possible framework could look like. From March to July of 2024, we held 5 meetings of this work group, as you all know, and we had opportunities for written comments as well. All of those meeting recordings and presentations are available on our website at denvergov.org/naturalmedicine if you want to go back and watch any of the meetings that you might have missed or just refresh your memory on anything. And then from August to October of this year, we've been using the research that we've been doing, state rulemaking processes, the input that you've all provided us in these meetings and through written comments, and then feedback that we've gotten from other state and local agencies, as well as looking to what other jurisdictions are doing to help us develop a proposal on how Denver should proceed with regulating natural medicine in Denver. So that's what we've been doing for the past few months since we last met in July. We've been having a lot of internal conversations and information gathering and really working through some decisions to try and come to a proposal. So that brings us to today. So beginning in November of this year, we started drafting an ordinance to bring to City Council in first quarter of 2025. And we're bringing our proposal to you all today to present to you and get some questions and feedback. We don't have a draft ordinance ready just yet, but we have some high level concepts that we want to present to you and get some feedback on so that can inform our drafting process. So as a refresher, these are the topics that we covered in our 5 natural medicine work group meetings. So if you recall, in March, we asked you all to kind of bring your questions, your concerns, your priorities for natural medicine regulation. And that really drove the development of the agendas for the next 4 meetings. So we covered all of these different topics and had some really great and robust conversations that we've taken back to inform the proposal that we're going to present today. All right. With all of that background and refresher information in mind, I'm going to walk through part of our proposal for City Council, and then I will take a breath and hand it over to Erica to do the rest of it. So this proposal was developed using our own research, like I said, as well as all the input gathered from this group and from other agencies. We looked at rules promulgated by the state, and we also looked at neighboring jurisdictions and worked with our partner agencies to identify gaps and regulatory needs here locally. This proposal is not final. We are bringing it to you with open minds. We want to hear your feedback and your questions so that we can incorporate suggestions into our ordinance drafting and change direction if needed. But this is the proposal that the mayor has approved, and so this is what we're moving forward with. Once we have a draft ordinance prepared, it will be presented to Denver City Council. And then Denver City Council members also have the ability to amend the ordinance as well. So they have an opportunity to provide input and make changes. There will also be additional opportunities for public input during that City Council process. And so with all of that said, let's get into it. So we are coming to you with a comprehensive proposal. There are some changes that require City Council approval and some that are more programmatic in nature and don't require City Council approval. So our recommendations are grouped into 4 categories. Licensing of regulated activity or regulation of licensed activity, is the tip of the iceberg. This is a really important piece of the framework, but its success relies on the success of all the other pieces of this framework. At the foundation are public education and city training. The more that the public and our staff know about the risks, the opportunities, the history, and the rules related to natural medicine, the better off we'll all be. And then at the core of this work is enforcement against illegal activity. As we learned from the early days of marijuana legalization, success here impacts success across the board. When illicit activity goes unchecked, it undermines licensed businesses, and licensed businesses are subject to oversight by local and state agencies that provide critical protections for public health, public safety, and consumers, which is why we want to encourage participation in the regulated licensed marketplace and enforce when appropriate against activities that run afoul of state and local law. So like I said, some of the components of this proposal require an ordinance that has to be approved by City Council and the mayor. That includes regulation of licensed activity as well as unlawful acts. And then components that don't necessarily require City Council approval would be things like public education campaigns, training of city staff, and enforcement activities. But those things might also require additional funding to execute, which could require City Council approval. So starting with licensed activity, we'll get into the details of our proposal for regulation of licensed natural medicine businesses. This will include a limited licensing component, location requirements, operational requirements, and restrictions on advertising. And again, just keeping in mind that this is just one piece of a comprehensive citywide approach. So we had a good deal of discussion with this work group and across city agencies about whether to require a local license for cultivation, manufacturing, and testing facilities. For now, we've determined that state rules for cultivation, manufacturing, and testing facilities are comprehensive, and they place appropriate limits on allowed products and processes. We felt that the state rules adequately address public health and safety concerns, and our research didn't identify any gaps at this time that we would address with an additional local license. So for that reason, we're proposing to City Council that cultivation facilities, manufacturing facilities, and testing facilities will not be required to get an additional local Denver license in addition to that state license that they're required to get. However, we are proposing requiring a local license for healing centers. Our research identified some additional risks and potential community impacts here locally that may be associated with healing centers. And we believe that additional local oversight is necessary to make sure that those businesses are complying with state and local requirements. We anticipate that some healing centers are going to operate more like retreat centers, personal services style businesses, or social consumption venues. And, there may be other types of business models that we just haven't heard of yet. And so requiring a local license gives us greater oversight over these businesses and helps us mitigate risks to the community and mitigate impacts to the community. A local license also provides the city with an additional tool aside from criminal enforcement. It allows us to take non-criminal enforcement action when a healing center is operating out of compliance with the law. So without a local license, we would have to refer law violations to the police for criminal enforcement. A local license gives us, as the licensing authority, the ability to take steps to bring unlicensed operators into compliance rather than going the criminal enforcement route. We are also proposing a couple of exemptions to the local licensing requirement for healing centers. One exemption would be for anyone who is exempt from licensure by state law. So that would include, for example, individuals who are performing bona fide, culturally traditional spiritual ceremonies that are not associated with commercial or for-profit activity. We're also proposing an exemption for healing centers that are operated by clinical facilitators. Clinical facilitators are defined by the state as being authorized to provide natural medicine services to participants for the purpose of treating physical or behavioral mental health conditions. And they have to hold a current and active Colorado licensure in a profession that authorizes them to diagnose and treat those conditions. We anticipate that healing centers operated by clinical facilitators will operate in a more formal clinical setting and have additional oversight that's related to their secondary clinical licensure. And so we just don't anticipate that type of healing center posing the same types of community impacts and risks that other types of healing centers might. For location requirements for healing centers, as a reminder, state law requires that a healing center license cannot be issued to a location within 1,000 feet of a childcare center, preschool, elementary, middle, junior, or high school, or a residential childcare facility. And local jurisdictions have the authority to vary that distance restriction or eliminate one or more types of schools or childcare facilities from the application. Our proposal is to align with state law here, and we're not proposing any variation of the distance restrictions in statute. Our research did not identify data or compelling evidence that would support varying the distance restrictions in state law. We have heard from stakeholders that it might make sense to eliminate childcare facilities from the proximity requirement to accommodate more locations, but we haven't incorporated that suggestion yet, as we don't have data to support that change is necessary at this time. But we're always willing to revisit a policy in the future if it's necessary. For co-location requirements, we felt that, well, for some background, state rules permit healing centers, cultivation facilities, manufacturing facilities with identical owner licensees to share a location with one another, and testing facilities are not permitted to share a location with other natural medicine businesses. And then a natural medicine product manufacturer that manufactures natural medicine product using hazardous substances or dangerous chemicals is not permitted to be at the same licensed premises as a healing center. We felt that state rules adequately addressed safety concerns related to co-location of license types. And so we are proposing aligning with state rules and not imposing any additional restrictions on co-location. For operational requirements, local jurisdictions may impose limits on hours of operation. We are not proposing any limits on hours of operation for any type of natural medicine businesses. We heard feedback from stakeholders that there could be safety risks associated with limiting the hours of operation of a healing center and potentially forcing people to leave the healing center when it closes, prior to them being able to drive or being able to safely get home. So we didn't want to put limits on healing centers, and we didn't feel like there was a need for limits on hours of operation for any other type of natural medicine business license. State rules permit administration sessions to be conducted outdoors pursuant to certain requirements. We are proposing zoning natural medicine healing centers under existing uses in the Denver zoning code. So rather than creating a new type of zone use for healing centers, we'll be zoning them under the applicable zone use in the zoning code. And none of those applicable existing zone uses permit outdoor operations. So there won't be any allowances for outdoor administration sessions in Denver. And finally, state rules prescribe security requirements for natural medicine businesses and require those businesses to have a security plan. During this work group, we discussed whether there was a need for additional security requirements or secure storage requirements for natural medicine product. And we've determined that for now, state rules adequately address the security needs of natural medicine businesses. And so we are not proposing any additional security requirements beyond what's in state rules. But we will monitor burglary data and may reassess the need for secure storage requirements or other security requirements in the future. Okay. So the legislative intent, sorry, we'll get into advertising restrictions now. The legislative intent of the Natural Medicine Health Act notes that there is considerable risk of harm to Native American tribes and Indigenous people if natural medicine is overly commodified, commercialized, and exploited in a manner that results in the erasure of important cultural and religious context. One crucial way that we can prevent over-commodification and commercialization is by limiting advertising. Additionally, limiting advertising is an important tool that we've used in marijuana regulation that helps us prevent youth exposure to marketing of natural medicine products. And we know that marketing can lead to a lower perception of risk among youth of using those substances. So that's why we are recommending limiting advertising to natural medicine services only and prohibiting advertising of natural medicine and natural medicine products in the city of Denver. Natural medicine products and natural medicine can't be sold at retail. And so, there shouldn't be a need to advertise those products to the public generally. We're also proposing a prohibition on outdoor advertising of natural medicine services in Denver. We have a similar prohibition on outdoor advertising of marijuana in Denver. And so it would likely look pretty similar to what's in our code for that. And finally, we haven't yet determined a license fee for healing centers. It will depend on the application requirements, the inspection requirements, how much time it takes for us to process those licenses and perform inspections on those licenses. But we anticipate, just looking at comparable types of licenses, that the annual fee for a healing center license would likely fall between $200 and $500. And that fee would be due upon initial application and each year upon renewal. The Department of Excise and Licenses determines fees based on the cost to the city of administering the license, and we are not permitted to charge more than what it costs us to administer the license. So that calculation includes things like our operating expenses and then staff time spent processing applications and performing inspections. So I will pass it over to Erica to walk through the rest of the proposal.
Thank you, Abby. Good morning, everyone. For anyone listening, I'm Erica Rogers. I'm the policy director here in Excise and Licenses. Nice to see you all again on the work group. So I'm going to jump in here and talk about the other pieces of our comprehensive set of recommendations in our proposal. So the next thing that we'll talk about is enforcement. And I think first and foremost, we acknowledge that the impacts of criminal enforcement of drug laws has historically had negative impacts on marginalized and specific communities. And so we want to be intentional about how we address risks related to natural medicine in our community. So as licensed natural medicine facilities come online and more Coloradans and Denverites learn about personal use provisions, we do anticipate seeing some of the same risks. Many of them were brought up here in this work group, similar to when we saw marijuana coming online. So some of those public health and safety concerns include a proliferation of maybe questionable or unlawful products, maybe ease of access, and confusion just around the line between licensed and regulated activity, personal use provisions, and a potential gray market that could arise just both among the naive or the opportunistic. So in our proposed ordinance, we would focus our enforcement efforts on unlawful retail sales and unlawful advertising, as well as unlawful personal cultivation and manufacturing, right? So as Abby mentioned, there will be no outdoor advertising, advertising of services only, and we'd be looking to uphold those state limits on the types of products that can be produced both at the regulated level and personal use to ensure we aren't seeing any other types of those products. I know that can be a challenge for some of our enforcement teams and for unsuspecting customers who are expecting the city to do a level of consumer protection. So those features of the enforcement piece will ensure that that regulated community isn't undermined by a gray market while still holding space for those lawful personal and traditional uses. And another key piece of this, right, in lockstep with enforcement, right, is city training, right? So some city training has taken place here in Denver, some of our first responders, but we do see additional city training as a key piece of our programming that will support the success of a natural medicine framework in Denver. So that proper city training ensures that we're enforcing those provisions thoughtfully and respectfully, that we're providing adequate services to residents seeking, healthcare or other types of services. We want to be respectful in all of our interactions with the public. So we want to ensure also that we're adequately tracking our public health impacts and adapting to the needs of our residents and our city. So by training city staff on how to track those developments and those trends, we can more accurately direct our city resources to the areas that need them most. Some of the personnel that we would recommend training for are including, but not limited to, again, our first responders, including STAR, our law enforcement officers, park rangers, event staff, and city contracted service providers who may be interacting with populations with specific needs. For example, we have some city contracted service providers that provide services to our unhoused neighbors or community members who are in recovery from substance abuse. And now the cornerstone right here, public education. This is something that we heard a lot about from our work group members, and we are elevating it to be a key piece of our programmatic recommendations. We'd love to see a comprehensive approach to coordinating, developing, and amplifying education in 4 specific areas, right? Not just saying education as a broad blanket, but being specific and intentional about the types of education that we are working on and planning and putting energy into as a city. So first, natural medicine work group members emphasized that education is crucial to preserving the historical, cultural, and religious context behind natural medicine, as well as educating the public on the link between natural medicine and the environment. So a core piece of our educational recommendations will live there. Another section of public education will be about state and local natural medicine laws. This is a place where our department, in conjunction with the state, can provide resources to ensure that people know what the law is, what the regulated market looks like, and that they have the information they need to make those good choices from a consumer protection standpoint. The third piece of public education will be the behavioral and public health concerns. This will focus on kind of harm reduction. It will also look at concerning trends and products, as I mentioned, right? And just information about public health risks for those consumers. And then finally, the fourth piece of our multi-pronged educational approach would be youth education. So looking at how we can educate youth about what's happening, what's changing, and how they play into it. So this slide goes into a little bit more details of each of those buckets. We've started to identify city partners that we can work with, community partners that we can work with. And we just kind of wanted to report back on kind of our plans, get your feedback, and of course, open the floor for further engagement and further collaboration in any and all of these areas. So first, regarding the Indigenous and Native American traditions, Denver's Climate Action, Sustainability, and Resiliency Office has a Tribal Communities Climate Justice Program. and they're poised to incorporate education on mycelium conservation into its programming, among other things. We will also be looking for additional guidance from the state's federally recognized tribes and indigenous communities working group, as well as the Denver American Indian Commission. Val wasn't able to be here today, unfortunately, but she's super excited to take on this work. And she mentioned that there's funding for additional opportunities to collaborate, to consult, to provide information to the city. And so she'll be reaching out with more information about that, but we'll also be talking about that when we go to City Council. As I mentioned, our department, as well as the state, will expand our Know the Law public education efforts. We've done a lot of Know the Law type is the name of the campaign we've done with marijuana. We would look to replicate some of that, also informed, by the differences between marijuana and natural medicine. We'd also work with the Office of Special Events. We know that there are going to be a lot of questions, maybe at farmers markets or other events, about personal sharing provisions, as well as whether products can be sold or not by vendors. So we'll be working closely with them to provide the vendors and the event organizers with the information that they need, so that they can easily be compliant and provide additional information to the community. Our partners at the Denver Public Health and DDPHE will take on public health and behavioral health topics. I think they're already talking to some groups about some public education campaign about risks and harm reduction. And then on youth education, we're going to look at a couple of different avenues, including tapping in our Office of Children's Affairs. They have curriculum, existing curriculum on different types of healthy life choices. And we want to explore incorporating information on natural medicine and other psychedelic substances into that curriculum. Of note, I think we've discussed this at previous meetings. There is a very low usage of psychedelic substances in Denver, according to public health data available. But of course, we will continue to monitor data for concerning trends. All right, now we'll talk about next steps and process and how you can continue to be involved if you so choose. So we are here in December. We've presented our recommendations as a proposal to all of you. We're working on that draft ordinance, and we hope to have a draft that we can bring to City Council early next year, hopefully January, February-ish, depending on calendars. But we would publish the draft on our website. We would share it with the work group. We would take it to council. And part of the council process includes a public committee meeting, testimony, opportunities for testimony, opportunities for input, not just to us now, but to the city council members, two of which are representatives on this group. So there will be continued, yes, thank you, Councilman Hines. There will be continued opportunities to weigh in. Your voice and your opinions don't stop here, but we'll hand it over to our legislators. If that ordinance passes, then between March and May, we would build and release the Healing Center license application that Abby talked about, and officially start launching our public education efforts. And then throughout the year and onward, right, we'd continue to monitor those impacts, perhaps look for any unintended consequences, and of course, update our policies and strategies as needed to reflect the needs of our community. So we've linked more additional information about the legislative process, how to provide that public input, and how to contact your city council member in case you're curious about getting a head start on that process. So I mentioned unintended consequences, right? And so I think Molly and Abby both alluded to this, but I'll reiterate here that it's important to note that these reflect what we know today. So one thing that we know is that successful regulation of natural medicine requires a coordinated approach to monitoring the data, looking at trends, and reassessing when we learn new information. So these are some of the things that we heard at this work group that really affect the balance of this recommendation set. And so these are some of the things, not all, of course, but some of the big buckets of things that we'll be looking for and paying attention to, and constantly, kind of making sure that our system fits the needs. So some of those include federal guidance or enforcement. As you all know, we have a new federal administration coming in on board on January. I think everyone in the community has a different thought or expectation of how that will impact natural medicine. So We'll be following very closely to see what that actual impact is and whether it changes anything for us. We'll also keep an eye on any changes to state law or state rules, public health data and trends, youth usage trends, crime data trends, staffing data trends from the regulated community, any equity concerns, whether anticipated or unanticipated, and then, of course, here in Denver locally, unanticipated neighborhood impacts, right? If there are things that we just all missed, that's okay. That's part of being human. We can come back to the drawing board and look to move forward. So just wanted to make sure that you all knew that this isn't the end of our work here. It may be the last work group meeting we have, but it just means the work is going to continue forward in new ways, informed by all of these things. So with that, I think we can move to discussion for the work group. It's pretty open-ended, but if anyone has questions, concerns, suggestions, or feedback about the proposal or any piece of it, the floor is open for those comments. I think Michael had his hand up, and then Nico I see as well.
Excellent. Thank you so much. Apologies for not being on camera. I'm in the middle of a coffee shop here. So first of all, just wanted to thank everybody on the work group and all the work that the group here in Denver has been doing. I know this is no small undertaking, so really want to appreciate that. Also appreciate the caring attention by the city council who will be voting on this later. Councilperson Hines, I see you're on the call. I'm one of your constituents, so I'm excited to see you participating here. My name is Michael Briggs. I'm the president of Spiritus Oregon, which is the nation's first legal psilocybin edible company. And my comment regards the advertising of products and the prohibition thereof in Denver. So my comment is that there are already pretty strict rules around what's allowable from an advertising perspective at the state level. There are audience composition rules in terms of ensuring that the vast majority of your audience is over the age of 21. And so the impact of this rule would mean something like, if a product was advertised in a dispensary, that would be considered illegal, where that the audience is wholly comprised of individuals over the age of 21. There are ID checks at the door confirming that. So I just think that it might be better in this instance to stick with the state regulations at this point in time, and not imposing further restrictions over and above those. Thank you.
Michael, we'll go to Nico next.
Hello, this is Nico Skivaski from Althea Public Benefit. Echoing what Michael said, first off, I want to thank everyone at EXL for the work you've put in here. It's clear that you've taken our opinions into consideration, as well as the additional research required to put this proposal together. So I really appreciate that. That being said, I would like to communicate my objection to the local licensure requirement for healing centers. These businesses already have a large regulatory burden, including detailed rules, reporting requirements, and costs associated with the state license. State rules already require healing centers to follow strict processes that greatly restrict how these medicines are administered, and therefore the types of healing center businesses that are possible. And I fear that adding this additional local licensure requirement will further restrict these businesses and create additional burdens. With the caveat that Oregon has a very different program, but similar in a lot of ways. From my experience working within that market, we haven't seen these types of businesses that you described that fall outside of the intended program. What we have seen there is how difficult it has been for Oregon service centers to operate within their similar rules and regulations, and how these burdens have made those services extremely costly for consumers, making accessibility exceedingly difficult, not to mention making those businesses work from an economic perspective. Additionally, the spirit of the state law was to create a natural medicine program that does not require diagnosis or medical use. This local license, as described, benefits the medicalized approach, unfairly benefiting those licensees who are clinical facilitators, which is outside of the spirit of the program. So for these reasons, I would ask that the local licensure requirement be removed from the proposal. At the very least, microhealing centers should be excluded as well, because those that specific type of healing center licensure already restricts the volumes, the commercial volumes that will be available, reducing the possibility to operate outside of the intended program. So I would take that at the very least. Switching gears a little bit to the distance requirements, I would also like to request that that Denver consider reducing the distance requirements for these types of businesses because the city is densely populated. The 1,000-foot restriction will dramatically reduce the possible locations for these businesses, which, as we've discussed previously, will not create public disturbances in their indoor and controlled settings. So that is all I have to say about the proposal. Thank you.
We'll go to Carissa next.
Hi, Carissa Garcia, Indigenous Justice and Environmental Justice Advocate and Consultant. Like everyone else, huge thank you to Excise and Licensing for all the work we've done, and to the working group for all that we've done throughout the year. So it's really great to see the progress and to see the culmination of our work. So thank you for the proposal. Before I get into my questions, I do want to agree with Nico around the distances, in that not so much because of the density, but because of these distance regulations, this often pushes industry to other neighborhoods, which tend to be disproportionately impacted communities when it comes to environmental impact. And so we see this with various industries and even with marijuana. So something to consider moving forward with that. I'll try to blow through these, but I have been in communication and been talking with communities and people who have trusted me to relay their questions and their concerns, most of whom are people of color and Indigenous people, medicine workers and healers. And so I'd like to get these out. I know that some are regarding state law. So if in the chat, if it's not relevant here, if you could put in a link or a contact or somebody for that information, that would be great. First and foremost, what I've heard from most people who are interested in licensing is that the issue is less about affordability of the license itself, and it's more about access to space, real estate being the biggest issue, in that when we talk about equity and we talk about access for Indigenous people, many of us don't have tens of thousands or even hundreds of thousands of dollars to put into real estate, whether that's leasing or purchasing for cultivation centers, for healing centers. And so there's a huge barrier when it comes to real estate for businesses, not so much the licensing. So the question that I'm receiving is, what are the existing programs for Black and Indigenous people for making commercial real estate more accessible? We understand and know that the city and state has land and buildings in trusts that are, vacant and not being used. Are there programs to make these spaces accessible for natural medicine businesses?
That's a great question, Carissa. I am writing it down. I don't have the answer off the top of my head, but this is a challenge that we've had with marijuana businesses as well. And so let me do some research into other city programs that we might be able to share information about, or state programs that we might be able to share information about, and I can follow up.
Great, thank you very much. Another comment on this topic has been that we understand that there is space for home cultivation and manufacturing based on the draft rules. However, many people are concerned that if they have children at home, they don't want to conduct this business in their homes with children. And so that kind of also the amount of space needed. When we get into manufacturing, you're talking about safety issues. So just saying, I know we briefly touched on this in a previous meeting, working group meeting, but just saying, oh, you can grow in your house or manufacture in your house is really not serving the needs. So thank you for that. Other things are concerns around for healing centers. In reviewing the draft rules, it was my understanding that healing centers and facilitators are not allowed to provide patients or clients with medicine to take home or take outside of the facility. Is that correct?
Yes, that's correct.
Okay, so in the case of like ongoing daily care through that is not something that healing centers or facilitators or clinicians could take on. These are kind of one-time sessions, if you will. Not like, hey, for your ongoing care, here's some microdoses, or here's, a plan for your ongoing care in regard to natural medicine. We're not touching any of that right now. Is that correct?
That is not something that we're addressing through our local regulations, but that would be addressed by the Department of Regulatory Agencies, so by DORA.
Okay.
And that's been a topic of discussion at the Natural Medicine Advisory Board meetings. And so I can put some links to that website in the chat so that you can follow along with that conversation at the state level. I don't want to speak out of turn on their regulations, but as it stands now, natural medicine has to remain on the premises. You couldn't leave with it and take it with you.
Okay, thank you. So also in regard to that, people and clinicians, facilitators, healing centers that I've, or owners of healing centers that I've talked with are really looking for guidance around liability, around for their business, around dosing, and for if things go bad, right? If somebody has a negative or an unhealthy or dangerous reaction, who and where does that liability lie? Is it simply covered with, a signed waiver, or is there some other precautions that healing centers and facilitators should take? If you have any information, we don't have to discuss that now, but if you have any information on that, that would be great. Also, if that's a DORA question, I understand.
Yeah, I think that would be more of a DORA question.
Okay.
And I can also, I think we have some folks from the state on the call. So Ian or Allison, feel free to jump in, but don't feel like you have to, but we can provide that information on DORA's regulations in the chat.
Great, thank you. Another question in that area is, who is the responsible prescriber? And is there any update that can be provided around billing? What billing is going to look like with natural medicine? I understand that ketamine can now be billed to Medicaid. How will the natural medicine be billed to Medicaid, and is that something that is being discussed, or where can I find that information?
That's a good question. I'm not sure of the answer. ENC is the governor's advisor on natural medicine policy and may have some more information on where the state stands on that. So maybe he can pop some information in the chat.
I'm sorry, can you repeat the question? I'm multitasking and I missed that question.
Sure. The clinicians are asking me who the responsible prescriber will be when in regards to facilitation and natural medicine healing centers. Also, what that will look like with billing Medicaid.
I cannot speak to billing insurance. I would suggest reaching out to Dora. The one-to-one relationship will be between facilitators and participants. And so I would direct any questions related to that over to Dora.
Okay.
And I
thank
apologize that I can't answer that directly for you, Carissa.
No problem. Thanks, Ian. My last question is, actually I have two more quick questions. This might also be a state question, but I've had multiple people ask about how the laws will affect unincorporated Jefferson County. So if there's anybody with the state that can talk with me about that, maybe offline, that would be great. Since they're concerned historically with their county following different, walking to a different beat. So if anybody wants to reach out to me in the chat, that would be helpful. And finally, regarding licensing and education, I totally support what was put up on the slides and discussed here as far as the priorities of education. So thank you very much about that. And my question is, my comment is I would advocate for accessibility, that if possible to make those educational sessions and that information free to people. The other thing is there any required education for at the city and county level for licensing?
We're not proposing any education requirements at the local level for license applicants for a healing center license. The education requirements mainly fall under Dora's rules for facilitators.
Okay. And I read that already. So okay, I think that's all I got. Sorry to like fire all those at you. I was trying to do it as quickly as possible, but please, if you anybody here has any more information on the questions that I asked, I would really appreciate it to reach out, and I will circle back with Dora and state on some of those other questions. Thank you so much.
Yeah, thank you so much, Carissa, and we really appreciate all questions, even if they're ones that we don't necessarily have the answers to, because that helps us identify other areas of concern that we might need to look into.
Great.
Let's go to Thomas next.
Thank you. I just had a kind of combination of these things. First, thank you for all the work put into, doing this for Denver. I being a Native American born and raised here in Denver, it felt very good to be included in some of these meetings and some of these discussions. But also, concern was there wasn't too much communication or information around how this is being handled on the indigenous Native American side. We are not perfect, and so we do have complex issues which regard our own community. There is a pedigree issue there, You know, do you have a tribal ID? Do you represent our people? Are you just somebody who's a hang around person who hangs around the community and then, you know, gets promoted to this level because they have, you know, the necessary skills, but not the necessary pedigree or even represent, you know, our people? There, I see people on NPR, you know, talking about how they're not being represented, how, you know, some of the native indigenous concerns are not being, you know, addressed, and they are. You know, I'm here, I work, you know, on this. I work on many things in, you know, the community. I'm an American Indian commissioner for Denver. And so I was just concerned about, you know, the communication out of saying, you know, we are garnering, you know, this input, we are garnering, you know, verified and vetted, you know, people here. Not perfect, you know. Navajo Nation, you know, is also, you know, not in Colorado, but they do have, you know, 50% of the population in Denver. So, you know, having all stakeholders at the table or just communicating out, you know, hey, we are making this effort would go a long ways. Our community communicates through word of mouth. And so now that, you know, these things are coming to the forefront, you know, people are on NPR, it's in the news, these kind of meetings, it would be good just to have, you know, a kind of a background or, you know, the efforts made forward because our community is always traumatized about being used. You know, we're not real trustful of the government. And so, you know, just communicating out, you know, hey, this is our endeavors. This is what we're doing. We're collaborating with other agencies to try and, you know, get this voice, get your concerns out here, so that we can, you know, appropriately address them should there be any concerns, any suggestions, or if we're missing any gaps. So I just wanted to say, you know, that as a possible suggestion, you know, just the communication out, because now that, you know, these things are gaining traction, a lot of people in the community now are reaching out and saying, you know, we weren't we weren't consulted, we weren't whatever it is, and you know, there needs to be an appropriate line of authority or a hierarchy that you guys could, you know, put out so that, you know, people aren't coming to the table misinformed. And so that was one of the concerns or suggestion or feedback that I had about this proposal. Everything else, this is a very complex things. You know, we're dealing with regulation, we're dealing with rule, we're dealing with clinical research. All of these things have to be appropriate. They have to be clean. The data has to be clean. You know, regulations have to be followed, because that's the system that we work into. So it's just my suggestion to kind of if not put out, you know, some kind of blurb or any kind of anything out there, because the community sometimes is historically traumatized, and it's, you know, it's what happens. And so I don't want, you know, this group or any other group to um get a backlash because you guys are doing all the right things, and you know, you are garnering, you know, what is needed for input. Possibly more input because, you know, there are 570 plus tribes just in the United States who are federally recognized. Some of these medicines come from places where they're not in the US, they're not federally recognized tribes. So then again, there's some complex issues there. And then it can go further down the line of what are there people who do have federally recognized status but also have children who are from other areas such as South America, then their children would have purview over, you know, they would have federal recognized status and then also birthright to some of these medicines, some of these therapies, you know, by, you know, their parents teaching them these things. I don't think any of these things were kind of fleshed out or thought of initially. But this is just some of my input putting there. You know, I appreciate, you know, all of the work again, put it into this regulations in these groups. I just feel like a lot more could be done communicating out the indigenous or the Native American part. Thank you.
Thanks so much for that feedback and for the reminder. I think we, you know, there's always more that we can do in terms of communicating with stakeholders. And so we're happy to come to any meetings that anybody's interested in inviting us to, or meet with any stakeholders who are interested and talk some more and get some more feedback. And then that's a great reminder for us to make sure we're sharing all the information about city council dates and more opportunities for public input with all of the communities who might be interested. So appreciate that. Councilman Hines.
Thank you, Chris Hines, Denver City Council's District 10. Just a few thoughts. First, regarding the setback requirements, I know that a couple people have commented about the setback requirements already. I certainly understand why Excise and Licenses is using applicable setback requirements in other areas, like cannabis and syringe access. I would say that there is an active process underway right now to modify the setback requirements for syringe access. And so I hope that Excise and Licenses considers that in addition to the comment that the comments we've heard this morning. And then I just say that I understand and get why we would not allow outdoor events or healing to occur here in Denver. The state is promulgating laws that include the Western Slope and the Eastern Plains. We are a dense urban city, and so I don't think anyone's really said anything about concerns about outdoor events. But I just I wanted to support Excise and Licenses in that comment. And then someone had mentioned accessibility, I think was regarding accessibility for particular communities. I hope that physical accessibility for people with disabilities is concerned or is considered. I would imagine that it is considered in any sort of requirement, but I just hope there isn't an exception in this case. And then the last thing I'd say is I look forward to the Excise and Licenses comments or thoughts regarding the comments about the local license requirements, because we've heard that concern 2 or 3 times this morning. Thank you.
Thank you. Let's go to Dale next.
Thanks, Dale Terasaki, Denver Health, and also RMPDS. First of all, I just wanted to speak regarding one of Carissa's questions regarding Medicaid coverage for some of these services. At least in my understanding right now, and of course, I'm not representing healthcare policy and finance or any other state entity. I do not believe that any of these services, including administration or the product itself, is on the table for Medicaid coverage at the moment. Partly this relates to the fact that Medicaid is a federal program and psilocybin is a Schedule I substance still at the moment. And so, yeah, that's my understanding, at least at the moment. And then secondly, just wanted to express appreciation for the exception for clinical facilitator associated healing centers with this license. So I appreciate that consideration. Thank you.
You're the MVP backup.
Thank you. Go to Gabriella next.
Good morning, everyone. Yeah, happy to see some of our feedback incorporated. And of course, there's much to review. So one question I have with some of the research and going to the different stakeholders groups was, you didn't mention the tribal nations and indigenous community working groups. So I'm curious if you all were present at those meetings and you incorporated some of the feedback.
Yes, we've been present. I've been present and listening to all of those meetings. They haven't provided specific feedback on sort of the local concern piece, but we're definitely listening, and we are eager to read their final report and hoping that there's some recommendations in there that we can include.
Okay, thank you. Yeah, so this is the first time that I'm seeing the draft. And so I kind of want to understand, you've mentioned like we can go to testimony, we can have all these different opportunities to add feedback. So I'd love to see the report. I'd love to, just to be able to have time to review it, to be able to offer feedback in the different ways. Also have that time to share it with my community, go over it. And so, if I could just get more clarification around the timeframes. You mentioned next month, we're already in December. In December, you're going to be presenting a draft. So yeah, could you clarify that a little bit, like what's going on this month? And will we be able to look at this again or perhaps have another meeting?
I can clarify. Yeah, sure. Thanks, Gabby. So we have the proposal here today, right, for our natural medicine work group members. The draft of the ordinance itself is not finished yet. As soon as we have a draft that we can share publicly, we will share it. We would not go to council until we had a draft to share. So there would be time to review the language, review it against what we've talked about today, get some feedback before that public process starts with city council. So, and of course, I think, I don't want to speak for our council representatives, but I know they're always very responsive to the community and community feedback. So I think both on the record and, you know, they take constituent feedback all the time.
Great, thank you. And of course, there's, you know, I've been pretty vocal since the beginning about concerns about how the bill was written without consent and consultation and permission, and it was not written by Indigenous people. And the natural medicine boards also are not reflective of our communities. So my concern is around commodification. And so you've mentioned advertising, kind of limiting what can and cannot be advertised. So, you know, there's a lot more than I can add there. And so yeah, I just want to say that I would love to expand on that, as you know, advertising is just one of many ways to limit that commodification. And so it's really important to get the feedback of the communities most impacted, because then we have to think about conservation and really listen here to the Indigenous and tribal communities working group. I think they have a lot more recommendations to add to this. And so with that, I'm curious on kind of that accountability mechanism or framework that you are going to have with tribal nations and the Indigenous community working group, right? So my understanding and being part of the formation of the board with the Senate, Stephen Fenberg, he's the one that added the Indigenous and religious, or helped us add that. It didn't actually come from the people who were drafting the bill. It came from some of the work that my community did. And the sole purpose wasn't necessarily like, I know you bolded like, hey, to prevent over commodification, but I just kind of want to state that that's not the sole purpose of it. And yeah, I would love to build in some more ways that we can be accountable, and what ways are we kind of really going beyond the land acknowledgement and really listening to the leadership of that working group. And I'm happy to see that the education piece, that you've placed the tribal Indigenous traditions and conservation as one of the, as a top priority. And so happy to see that. And also one of the things that concerns me a little bit with kind of receiving state funding, I would love to see grassroots organizations, grassroots community, Indigenous and BIPOC-led organizations funded, because a lot of the times we don't have access or the capability to apply to city RFPs, to state RFPs, to kind of go through those contracting methods that are, you know, have insurance requirements, have these really prohibitive and inaccessible applications and reporting requirements. And that's something that I've seen really flourish, especially in Denver, where you have a lot of grassroots community organizers starting to do this education. And so I would love to see them funded and for that funding to be accessible. My other concern also with not prioritizing that grassroots funding is the culture gap that exists. And sometimes when you are like state funded, there's a lot of things that you can't say. And so I would love for that flexibility for Indigenous and tribal communities to really set the stage for that education. Because if it's coming through this Western lens, which we've already seen the many ways that our traditions and our people are erased, and that cultural sensitivity and that cultural understanding isn't there. So yeah, it's kind of like Western education systems are now going to come in and teach about something that is so culturally sacred and sensitive to our communities. So I want there to be a way that is respected, right? That we're not forced through education into assimilation, or that this education is further harmful to our communities. And my understanding too is, I haven't been, there's a lot to keep up on as far as all of the Natural Medicine Health Act meetings. And so my understanding is that first we're starting with phasing in psilocybin. That's already what we're building here is primarily around psilocybin, and then the different medicines will be phased in. And so my concern with that is that, when this bill was written, it kind of, all of the medicines were lumped in together. The different traditions and their ecosystems and the people who steward them, most of them are not here, even in the United States on Turtle Island. So as we go along, and I understand this working group won't go on forever, that we do need to consider the impacts and have these meetings with the different communities to understand the impacts on conservation, on commodification. So I'm curious if that is a plan. I know the Indigenous and Religious Subcommittee, or excuse me, the working group is only planned to go on for 9 months. I know they're pushing it for it to be extended because this bill is indefinite. So the impacts will keep going on. So I'd love to see something like that continue with the city of Denver also, and also Indigenous led and centered. And one concern too is how, when we're going back to the people that don't need to have a license, is the bona fide spiritual practice. I forget the term, but people who are genuinely Indigenous and have the consent from their communities to practice these medicines according to the American Indian Religious Freedom Act. And, we've talked extensively on how the complexities around some people from these traditions aren't federally recognized. And that's a whole thing in itself. But my concern is like you've mentioned, right, the criminalization and the history of the United States and the government on persecuting and criminalizing Indigenous people and people of color. So I would really love to understand that more, because one thing that we have seen from these bills is people who are not Indigenous are, claiming these lineages and forming churches and appropriating and claiming an identity that isn't theirs. And at the same time, I wouldn't want our communities don't need any further classification or for the government to decide who is and who isn't Indigenous. And that is really, really complex. So yeah, I think there's a lot to talk about there. And just overall, I've just asked for time, as I've mentioned that these recommendations are being drafted by primarily non-Indigenous people who don't really understand the impacts. So I just love to stay informed and inform my community of all this is happening. So I just ask for us to do that cautiously and carefully, and really consider these bigger impacts on the medicines and communities. So thank you.
Thank you. Yeah, thank you so much for that feedback. A lot for us to take back and think about. I think your comments about education and having the appropriate lens applied there is definitely something we are going to continue working on in coordination with the city's tribal communities climate justice program, and Valerie Herrera leads that program, and she wasn't able to be here today, but she is going to watch the recording and follow up once she's had an opportunity to do that. And so she'll have a chance to hear all of that feedback, and we want to make sure that we're staying in coordination there. And like Erica mentioned, there's some funding available through the city's climate protection fund that's set aside for equity purposes. And so Val can speak more to what that fund can be used for. But certainly wanted to flag that in response to your comments related to education. And then just reiterating again that we are watching closely the state's federally recognized tribes and indigenous communities working group, and eagerly anticipating their report. And hopefully that will come out as we're drafting, so that we can incorporate things if we're able to, or at least incorporate things into our future programming that don't necessarily require an ordinance to do so. Let's go next to Sean McAllister.
Good morning, everybody. Some amazing comments so far. Thank you to everybody who's contributed. I'm an attorney who helped draft NMHA and have worked with hundreds of people interested in this process. I live here in Denver, so this is...
Hey, Sean, I'm sorry to interrupt you. You're a little quiet.
Fine, yeah, I'll speak up. Just thank
you
for the work and saying I live in Denver and that I'm working with a lot of people interested in getting into this system. And for a lot of the comments that have already been made, I would just encourage people to get involved at the state level with the Department of Revenue and Department of Regulatory Affairs. They do need to incorporate social justice and indigenous issues into the work, and I think they're trying to do that. And your voices would be welcome at the state level. I don't think Denver can do a lot about this, but anything Denver can do, obviously, I support on that front. And I just have a few quick comments echoing a lot of what's already been said. I think it's hard to judge this proposal when you say the zoning districts will be the same as existing uses. So most of us are not zoning experts. So is this just medical zoning? Would this include commercial zoning? We'll really need to see specifically what zones would qualify for healing centers, because I appreciate no variation with the state setbacks, but as somebody else suggested, there might be a reason to reduce those setbacks, but we would really need to see a map of the city and get a sense of how many opportunities there will be to, I think it was somebody else's, Carissa's comment that if the zone districts look like there's only 5 places in the city you can do this, and they're all high expensive areas, hospitals, it's really going to reduce the opportunity. So it's hard to judge the proposal without understanding what the actual districts are. But assuming it's just medical or therapy office type places, I'm concerned that may be pretty restrictive and we should consider reducing the setbacks. Also not thrilled about no outdoor administration. I guess I appreciate that easy answer from the city, but this is also a critical element of a lot of these journeys, would be sitting in a courtyard with trees or flowers or nature. And I know Denver's not the most outdoorsy city, but I'm just really disappointed to hear that comment. And I think there should be provision made for outdoor administration. Also echo the advertisement concerns that I'm not sure what we're trying to accomplish with some of these prohibitions when there already are state rules that limit advertisement and the audience, et cetera. So, and then finally, just I I guess it's a disappointment to see that we're looking at March to May before we can start applying. I know this process has been very extensive and you've included a lot of people, and I appreciate that. But I guess my urging, we can't change where we are, but my urging is to make this go as fast as possible, only because people are trying to make plans and executing leases, and we're hoping to open, you know, sooner than that time frame. And if they can't even apply until May of next year, that's certainly beyond the expectation of what people were hoping for, given the state applications will be ready at the end of the year. So it is what it is, but to the extent we could get this going and finish the work sooner than May, that would be amazing, and help people who are investing money and time already, hoping the city would have already been farther along. So thank you all very much.
Sean, that's a great point, and we want to make sure we're moving as quickly as possible. And so that's part of the reason that we're not doing a text amendment to the zoning code to update our zone uses to create new specific natural medicine zone uses. Instead, we're zoning under existing uses that already are in the zoning code, and we can apply them to natural medicine businesses. And so we have gotten your question and then a couple of questions in the Q&A about the specific zone districts. So I will preface this by saying that I am not a zoning expert by any stretch of the imagination. We do have Tina Axelrad here on the call. And so Tina, I will look to you to correct me if I'm wrong about any of this, but I'll try and summarize as best I can. So the existing uses that we're looking at for healing centers, it sort of depends on the business model, right? You have to look at what type of business you're planning to do. So if it's going to be more of a medical office style business, it would be zoned as a medical office. If it's going to be more of that retreat style or personal services style business that's not sort of the clinical medical office style healing center, that would be zoned under our retail sales and service all others category. So it's a pretty broad category. And those are allowed in all commercial mixed use zone districts across the city. I will say that much of the city is just not zoned for retail sales because much of it is residential. But that's kind of the broadest zone use category that we could assign to healing centers. So it is fairly broad. For manufacturing facilities, I believe we're looking at a custom zone use designation. That is actually sort of the broadest designation for manufacturing facilities, despite the name custom, it is actually more general. So the custom zone use designation is allowed in almost all commercial -3+ mixed use zones across the city. For cultivation facilities, they would be zoned under, depending on sort of the size and scope of the facility, plant husbandry, which is what we zone marijuana cultivation facilities under, or also plant nursery, which is a broader cultivation facility designation. And plant nursery is allowed in almost all commercial -3+ mixed use zone districts across the city. So both for manufacturing and for cultivation, those zone districts are broader than what's currently allowed for marijuana manufacturing and cultivation. And that's because the processes and the size of natural medicine cultivation and manufacturing facilities are more limited than what's allowed for marijuana. And then finally, for testing facilities, they would be zoned under the lab research use, which is allowed, again, in almost all commercial -3+ mixed use zones across the city. So also to the outdoor administration session question that we had in the Q&A, again, we're zoning under existing uses for healing centers. We're not going through the process of creating new zone district designations specifically for natural medicine businesses, which would add significant time to this process. And so by zoning under existing uses, we are deferring to what's allowed for those existing uses And existing uses for healing centers just don't allow for outdoor operations. That's the rationale for that. Anything to add, Tina, or did I capture it
No,
correctly?
you did a great job. The critical point for those who are wondering is this is more, it's more generous in terms of the places and sites open to natural medicine businesses compared to marijuana. And then the other point is, we're just like with marijuana, we're treating a business very similar to other businesses in the city. A personal service, whether it's a massage or a salon or a dispenser of natural medicine, are all being treated the same. That's a very basic precept of land use control, is to treat similar uses similarly. We have personal service uses all over the city, and this would just be treated the same as. And that comes with a lot of opportunity to locate across the city. Same with cultivation. We did not go a more restrictive route like we did with marijuana. Virtually, you can grow inside a completely enclosed structure anywhere in the city. That's not single family or two family or multifamily.
Yeah. And we have a couple questions in the Q&A, but one is sort of relevant to this conversation. So Shannon asked, does this mean there will be no setback requirements for cultivation and manufacturing facilities? There's no distinct requirements for cultivation and manufacturing facilities in state law, and we are not proposing any here in Denver. Any other work group feedback or comments or discussion?
Abby, have you created the maps with the spacing distance overlapped with what zones they would be allowed in to show kind of geographically how those two things relate? Is that something our GIS department can do?
We haven't created those yet, but I think we'll tap into our GIS resources to do so.
I'd like to add one point just to address a question that looks like it keeps popping up. The outdoor prohibition, as Abby and Tina mentioned, right, treating similar businesses similarly, that is an existing limitation of many commercial zone uses in Denver. It's not specific to natural medicine, but it applies to existing doctor's offices. It applies to existing other types of retail. For example, one of the similar businesses Tina mentioned, like a massage facility, is not permitted to do that outside. And that's just a feature of our general Denver zoning code for many of these zone use districts. This isn't a new prohibition or a new development. It's, again, treating this type of business similarly to how we treat other types of similar businesses in Denver and have historically.
No.
Hi, I'm Noah Novella with Friday Ventures. I do potency testing and consulting for natural medicine in the personal use space. And I just want to touch on the outdoor use topic. I think that I understand the importance of being able to issue the licenses quickly and understand that's why it's being zoned this way. But I would hope that you guys, the city of Denver considers changing that in the future. I think outdoor use of natural medicine is very important, and it really, the use of natural medicine improves our connection with nature, and being able to sit in the grass and be outside really has a big impact there. So I think that it's important to reconsider allowing for outdoor use, and any safety concerns should be solved with the proper, fence and locked facility of any property of a healing center. I don't think there's any safety concerns there with a facilitator and a locked facility. Thank you.
Thanks, Noah. Councilman Hines?
Thank you, and thanks, Noah, for the comment, and Shane for the comments about outdoor activity. I do want, so there might not be any safety concerns. There might be some political or neighbor concerns with outdoor events, and so I want to make sure that if we are reconsidering whether they should be outdoor in the city of Denver, we also, as Noah had mentioned, fences or locked gates. I can imagine that someone will do some healing in Cheeseman Park, and the neighbors will go crazy, and so then we'll have some political pushback. And so I just want to set this up for success in the city of Denver, and we don't have some good things that they get taken away because of pushback from people who don't understand really what's happening. Thank you.
Go ahead. Your hand's raised.
Sorry, I didn't hear you. Are you calling for me?
Yes, go ahead.
Oh, I'm sorry. It just snapped back. So we do allow certain retail sales and services and repairs to be conducted outdoors in the city of Denver. I think the point is they're limited as to where those can occur, and they are typically pretty far distance and separated from residential neighborhoods. There's still an allowance, but your options for conducting it geographically are much more limited. So I don't want to say there's no way, and we can show that on any maps. It's a different category of retail use. We call it outdoor retail sales services. You won't be able to do it on Colfax or on Broadway or Federal, but as you move into the more industrial areas away from residential neighborhoods, that's where we start allowing the greater impact, higher impact in terms of external effects on surrounding properties. So it's not to say there will be zero opportunities. There'll be less opportunities than if you conduct it in a completely enclosed structure.
I don't see any other hands up, but Abby, would you mind to answer the question? There's a question in the chat, or a Q&A, sorry, about can you clarify what you mean by operated by a clinical facilitator in regards to the exemption from the local licensure requirement? And would one owner or operator who is a clinical facilitator meet that requirement?
Yeah, that's a good question. I think what we're looking to do with the exemption is to exempt those healing centers that are operated. And by operated, that's sort of a general term, right? We're looking at clinical facilitators that exclusively employ, are contracted with, or are owned by clinical facilitators. And, we're still thinking about how to best thread that needle and make sure that the exemption makes sense and is clear. But I don't think that just one owner or one clinical facilitator on staff would satisfy sort of the spirit of the requirement, which is to really exempt clinical healing centers, which is not a category of healing center that exists. And so that's what we're trying to get to with the clinical facilitators that are on staff. So if anyone has feedback about that, we are open to hearing it. Okay, Well, so we're gonna move to public comment in just a minute, but we do have a few minutes left for group discussion if anybody in the work group has any other thoughts before we move to comments from members of the audience. Okay. I'm trying to get my screens situated. Okay, let's move into our public comment section of the meeting. So during this time, attendees who are in the meeting can raise your hand using the raise hand button at the bottom of your Zoom screen. And we will give you the ability to unmute yourself. We ask that you just limit your comments to 3 minutes if you can. We have a timer just for your convenience to see how long you've been talking. But just out of respect for everyone and hoping to let everyone who wants to talk, just limiting the time that you're speaking would be great. So let's go first to Margarita. I will allow you to talk.
Thank you, Abby. Most of it's straightforward, just a couple of questions, and I don't know, maybe you'll be able to either answer them now or in some other format. I'm representing Almadelic. My couple questions is there's going to be difference for micro and macro healing centers? I know somebody already asked that question. And the second one is about timeline with the state. When you're going to license healing centers in the spring, but state start gathering applications in the beginning of January, would that work? If you can answer, I appreciate it. Thank you so much.
Sure. So if a business license is required by the city of Denver to operate the business, you would need to apply for and be granted a license by the city before you could operate the business. Our hope is to have an ordinance passed in the first quarter of next year. And we've already asked our Acela, our technology folks to start just looking at what it would take to create this new record in our online licensing system. So we're getting the ball rolling there so that we can be ready as soon as possible. We're looking at a timeline of probably April to May to be able to launch that application. But we know that there's been conversation at the state about how obviously there need to be licensed cultivation facilities first. There need to be licensed testing facilities first in order to have product for facilitators to use in administration sessions at healing centers. And there also need to be licensed facilitators first because a healing center has to have a facilitator on staff. So I think there will naturally be a delay at the state level in healing centers being able to get licensed. So hopefully our timing here locally matches up with the state timing and there's not too much of a delay.
I'm just wondering how those applications would work if somebody would decide to submit an application on state level and they not require a city license to submit on a state level. It may create a little bit of a turbulence.
I think we would look to be in communication with our state partners as we always have been about any license applications that they're receiving in Denver and any that might require a license application with Denver specifically.
Thank you, Abby.
Thank you. All right. I think next is Tasha Poinsett. I'm allowing you to unmute yourself.
First of all, I just want to echo the comments of folks on the on the work group, thanking you all for your effort in putting this together. And it really clearly seems that there's a commitment to supporting access and recognizing the potential of this program to support people who are struggling with mental health and other challenges in their lives. So really appreciate it. And with that, I just generally think that you've landed in a really solid place in terms of the local regulations. And I do want to comment on specifically on the local licensure piece. I think kind of echoing comments I heard from Nico near the beginning of the work group discussion, that I do find it a little concerning, this idea of requiring a local license if there's any single facilitator who's non-clinical affiliated with the Healing Center. There's a number of reasons why I think that can be problematic. The first one is just that this program was not designed to be exclusively clinical, and there is no requirement for a diagnosis or a prescription in order to access. And that really was by design, recognizing that in many cases, it's beneficial for people to start to work through issues that they have or symptoms that they may have. They may have depressive symptoms without being diagnosed with depression before it reaches the point of a diagnosis. And many of the facilitators in Oregon, for instance, are not licensed clinicians, and some of the most skilled and competent facilitators have experience in other pathways in their lives that help them develop the relevant skills to be able to do this work and do it really well. Of course, in conjunction with the training that they receive through the regulated program. So some examples of people that I've spoken to are, for instance, birth doulas who have moved into the realm of facilitation, or people who have worked at therapeutic boarding schools and really developed a lot of that nervous system capacity to be able to support people during very intense and challenging experiences. So that's one piece. And then I also think that even if you are focused on the clinical side, it's worth highlighting that there's a number of licensed professionals, including registered nurses, as well as naturopathic doctors, doctors of Chinese medicine, and others who do work in the realm of health and wellness, but don't fit into the clinical facilitator category. And I'm a little concerned if there's almost a disincentive for healing centers to contract with or employ those people, because by doing so, they would automatically then have to get local licensure and not only pay an extra fee, but I know that there's going to be extra paperwork and regulatory burden that goes with that. So just want to think about kind of the real implications of that kind of policy and encourage consideration of perhaps just, if you want to go that route, maybe it is just one clinical facilitator. And yeah, I guess I'd love to get more of an understanding of this concept of social consumption, because I don't see that as being really allowed or within the purview of this therapeutic model. So those are my comments. Thank you.
Thank you. All right. Let's go next to Dr. Cubbins. You should be able to unmute yourself. Dr. Cubbins? Are you able to unmute yourself? Okay, we will come back to you.
Hello.
Oh.
I'm on extended phone. Again, I'm sorry. Is this Abby?
Yes, we can hear you.
Okay. Thank you very much. Thanks for all your work on this. Having been part of the 2016 group that passed the original consumption amendment 300 in Denver, I always hearken back to what we're talking about when there is reference within the city in any use category that deals with setbacks. In my non-real estate analysis, I usually extend the word barrier instead of setbacks. And what I mean by that is, while we speak about cannabis not being related to natural medicines in a policy setting, we still make the rule based upon our 11 years of dealing with, or 9 years of dealing with, setbacks. So my general point is, as I said in the question, where is there and I understand public schools, I understand preschool, I understand high school. You could even make a case for junior college because we're talking about 21 plus. But again, within the context of setting a barrier, why are the areas of childcare so broad within the city of Denver? The childcare issue is very tough to zone around because you have a residential childcare proposal. And we went down this category of why we don't have any consumption clubs now operating in Denver, because a person could theoretically have set up a childcare residential center this morning when they heard about a proposed healing center opening in 2 months. I don't think that the city is trying to be anti-business or anti-healing center or anti-psilocybin, but it has the same effect. So I would very much like to take a page from the Las Vegas, Nevada setback theory, and that is 500 feet from a public school and no restrictions, because child care centers seems to presume that the adults in charge of someone under age 10 is going to allow that 9-year-old to wander 1,000 feet away and enter a healing center. If there's been proof of that in any other zone throughout the country, I would be very interested to see it. So once again, what I'll argue before council in 3 months, 2 months, whenever the ordinance comes up, is that there is no basis for child care centers being thrown in this barrier concept. I'm glad you have not touched addiction centers, alcohol treatment, opioid treatment, nicotine treatment. All these addictions go hand in hand with what we believe will be some benefits from psychedelic services administered by professionals. So that's great. But again, I don't see where the rationale has been made for just an arbitrary setback / barrier that relates to child care centers. Thank you very much.
Thank you. Next we'll go to Alton Dillard. Alton, you should be able to unmute yourself.
Good morning. Can you hear me?
Yes.
Hey, thanks for all your work on this, and just a few quick comments in the context of what you mentioned in the early part of the presentation, just about education and also just making sure youth are protected. I'm a resident of Denver and also a spokesperson for One Chance to Grow Up. So because the state rulemaking does allow for the product to be in the form of like gummies and chocolates and stuff, of course, that is a concern to us. And we also believe that in the course of the state rulemaking that there's a risk of diversion, because we do believe the state rulemaking does allow for removal of product from the healing centers. So just like with the cannabis issue, we're not trying to create a false equivalency here, because we do understand this is not a direct-to-consumer dispensary market in the way of cannabis, but just making sure that there's public education around the risk to youth. We've already had down in Colorado Springs a couple of 15-year-olds overdosed and were having to be hospitalized. We had a 19-year-old fall to his death off a crane while under the influence. So just making sure that people, as this rolls out over time, are keeping the protection of youth at the forefront. That's all I have. Thanks for your time.
Seeing any other hands raised that haven't already spoken? Oh, then, yeah, go ahead.
Hi, thanks, Abby, and the Denver team, Allison Robinette with the Colorado Natural Medicine Division. I know there's been a couple of comments today about allowances for product to leave healing centers or licensed premises. I did want to provide a little bit of clarity. There is no allowance for product, natural medicine product, to leave with participants. The narrow allowance allows facilitators to obtain regulated natural medicine for purposes of administration sessions, and any remaining product must be returned to a licensee for destruction. So I just wanted to clarify that nuance in our rules. Thank you.
Thanks, Allison. Appreciate that. All right, well, we have about 9 minutes left in our meeting time. So if anybody has any work group members have any closing thoughts, please feel free to share. And as always, if you have thoughts that come to mind after this meeting or just additional feedback that you didn't get the chance to share, the best way to share that is to send it to exlpolicy@denvergov.org. I will see it, I'll read it, I'll make sure that we all take it into consideration as we're working on this draft ordinance and executing the other programmatic pieces of this proposal, so feel free. Any other closing thoughts from any work group members? Oh, Carissa, please go ahead.
Yeah, I just like to comment on first also reiterating what some of Gabby's comments about asking that you please keep Indigenous peoples included through the process. And, you know, I also look forward to a time when Indigenous peoples will be leading this process, not just in liaison to our people, but in the process itself. So I'm not going to repeat what Gabby said. She said so much good information, but I wanted to repeat that part. The other thing is I'd also like to, you know, add more support to looking into and reviewing the outdoor use. I specifically, like, I know people who have bought land and property away to create their healing center, you know, to provide that healing outdoor space with natural medicine and, you know, culturally with the medicine, it's pretty typical to involve outdoor space. And, you know, we're not talking about going to the local park where all the kids are. We're talking about, like, you know, cabins turned into healing centers on acreage of land where there's like not many other people around, those kinds of things. But there should still be outdoor accessibility, even like, you know, in the urban areas as well. So I just wanted to put out my support to review that and hopefully make some modification to that. Thank you.
All right, well, with just a few minutes left, I think we can wrap up. Thank you all so much for being here today and for all of your thoughtful feedback. Any closing thoughts, Molly?
Just again, appreciate all the insights and information. And I think that you guys continue to give us good things to think about and take into consideration. So no, just really helpful feedback and appreciate everybody's participation today. And I think, you know, we've been through next steps and stuff, so you'll definitely be hopefully seeing a draft in, you know, and we'll definitely notify this group once that is available for your review. We'll send a notification out. So yeah, but thank you guys. And thank you, Abby and Erica, again.